awareness. So my first question, and before that, I will request Dr. Lily to join the panel. Dr. Lily is a senior diabetologist, and we want that this challenge is um, there, and female should be very important partner in this panel. But anyone can have answer, anyone can ask the question. The first thing which I want to ask, uh, do diabetic patient report these urinary symptoms proactively, or do they tend to underreport or normalize them unless specifically asked? So, Dr. Jha, this is in your practice of medical school for more than 30 years, and now you are in the private practice last 5-10 years. Do you find that a person with diabetes they report these type of urinary symptoms very proactively? And then I will also ask the same question to the audience after Dr. Jha answer that. How many of you will believe that what Dr. Jha is saying, or what is your opinion? Yes, Dr. Jha.
Firstly, I would like to congratulate Dr. Bansi Sabo and Diabetes India team to include such an important topic which involves 1/3 of the female population, almost, different studies, and 15 to 20% of the male population beyond the age of 65 years. And all of us know that with life expectancy increasing, the number of geriatric patients are increasing, and this is a real problem. And what is very important is that most of these problems could be solved if the mental function is okay and if the muscle function is okay. So this is a very important topic, and the question he has put, yes, in our practice we do get such cases. But if we are short of time and if we are not able to put our patients at ease, then those cases are likely to be missed. And one amount of incontinence and wetting of the inner clothes, that shakes the confidence of the patient. And as he has already told that we are short of time in our private practice, in those cases, elderly patients, we should take out some time to make themselves comfortable, and we should ask important leading question, and we should put them in a comfort mode. It's okay to have these problems, and you can lead life with dignity also.
How many of you think that this is a really proactively you have to ask it, or how many of you think that patients are giving complaint related to their urinary symptoms to you? So I may ask you, how many you think that they have to be asked very proactively if you ask in, because as he had said that number of people with these problem are very high, but it is less talked, less discussed. Neither we discuss in the conference, nor we have anything related to guidance. What should be done? We just don't have any idea. No international guideline for that. So anyone if want to say, or you just raise your hand that do you think that it is to be discussed proactively? It is not a solution. Either you have to ask, and there is a leading question, patient will not talk about it. Do you agree for that? Right. So now, the second very important, that among the urinary manifestation which you see in diabetes patient, which symptom most significantly affect patient daily functioning and overall quality of life? And as after SGLT2 inhibitor, I know that it is the genitomycotic infection which may be a leading challenge for them. But other than that, which urinary symptom which you feel is a very important manifestation of a complaint? And why I'm asking as a female diabetologist, because we see a lot of challenges with and with coughing, and many female patient complain also if we ask them in a leading question. So do you feel that urinary manifestation among in diabetes patient, will it be more? What is your experience, Dr. Lily?
Thank you, Dr. Banshi, for giving me this chance to discuss this very important topic along with all my esteemed colleagues here. Um, as you all agree, it's a very common problem, and it is not just in women, in males as well. But being a woman, I am told by many of my female patients, they may not be just postmenopausal, but even premenopausal patients who are diabetic over a period of time, who are uncontrolled, and who are probably a little obese. They are the ones who definitely have this problem, and they unless we ask them, they hesitate to tell you. The main symptom is even at night, they are unable to reach the toilet and they wet their clothes. And they are, it's not only a lack of quality, good quality for the patient, it is for the attendant as well. And sometimes they bedwet and then they wake up. I have seen this kind of patients. They were not even postmenopausal. And of course, postmenopausal women, apart from diabetes, they also can go through a syndrome called GSM. So genitourinary syndrome of menopause, which happens again with, this also can give rise to the same problem, urinary incontinence and stress incontinence, and because of the vasculopathy and neuropathy. So,
That's good.
so this is definitely important.
Thank you. Thank you, Dr. Lily. We have with us Dr. Vasant Kumar, very senior consultant, practicing since many years. Dr. Vasant Kumar, do you think that in clinic, such promotion, which is like initiative, putting this type of thing, will increase awareness, maybe in standee, in banner, in a leaflet or a samples? Because as we were discussing that, patient may not proactively say about it. So do you think that this type of things will help? Because then they can discuss it directly. Like the similar issue was that taboo was there for sexual dysfunction. I'm very frank. And then we started writing and telling that you please ask directly to your, your doctor and all these things. And now we are thinking, or we are seeing that now more number of patients straightway ask and complain about it. So do you think this will help?
I think Bansi, as our panelist said, first thing is we have to accept that this is relatively a common issue.
Exactly. Very true.
And it is also unfortunately ignored. Dr. Lily also mentioned, Dr. Jha mentioned, because of two reasons. One is the patients feel embarrassed to inform the doctor. Second thing, we as clinicians are busy and are also more focused on the more serious issues. We want to see the diabetes is under control, and we don't even ask them. So as you said, the point that you mentioned would definitely solve these issues to a great extent. And it's an embarrassing thing. So we need to handle that in a very sensitive manner, apart from also somewhere sensitize the person, or somewhere you are showing that do you have this problem? There is a solution. So they might be reminded to ask you the question at least, or even we are reminded.
Very true.
So I think that helps. That's
Thank
all
you.
from my
Very
side.
right. So, Dr. Rajput, I mean, from public health point of view, do you think that such type of one side is we are talking about the in clinic putting standees and creating a awareness and directly patient reaching out to the clinic, and then they see that these are the problems which we can also discuss. But you know that publicly people have stigma. They don't want to discuss neither to caregiver or to their friends. But if publicly on some platform, it can be, creating a awareness, maybe on social media, maybe on creating on electronic media, maybe on a print media, where we can discuss. There was like, this is a challenge. This is the people have problem with urinary incontinence, and there is a solution. I mean, reach out to your doctor. Does not mean that adult diaper is the only solution. It is one of the solution. We have to find the cause for it first. We have to find the treatment for it. We have to treat them also actively. And then we find that yes, some of the patients, or even intermittent use also. Rajesh, it's not necessarily that you have to give for lifelong. So that's the question from public health point of view.
Sir,
What is your opinion?
definitely in community, the biggest problem is regarding the awareness of the problem. Sometimes they are not aware that this is because of diabetes, because elderly population is facing this problem. They relate it with age, specifically females, those who are postmenopausal. Sometimes they relate that it is because of menopause, not because of diabetes. They are not fully convinced. That's why they don't discuss with their treating physician that this is my problem. Once they come out with this problem, they discuss it, they can find the solution. But awareness is the biggest problem. And sometimes we can't relate it with education only. Even the more literate are also embarrassed to discuss this problem with their physicians or their treating doctors. That's why if we create awareness on social platforms, we can address this problem that it is not an issue of embarrassment, it is because of long-standing disease that has caused this problem in them. And it is not person specific and they should come out with these issues to the doctor.
Rajesh, you want to make comment? Yes.
There are two things which we are confusing. Number one, diabetes per se does not causes incontinence.
No, we are not saying that.
नहीं नहीं
It,
मैं
it
क्या
is
कह
the
रहा हूँ?
diabetic
दूसरा,
autonomic neuropathy
as we ages, the there are many hormonal changes which are happening inside a female body, right? And there are mechanical changes which are happening.
Very true.
All of them are actually responsible for causing urinary incontinence. And diabetes per se prevalence increases as we ages, if we see the data. So there is no, these are just observation, not association finding that with diabetes there is more incontinence. As population ages, you have more diabetes. As population ages, you have more mechanical hormonal down regulations, so you have more incontinence. Only issue is, which I see in this subject is, that people does not perceive it as a problem, does not come forward to discuss it, to find the proper solutions.
Exactly.
These things should be made aware through public education programs. Because a doctor, a physician cannot treat incontinence by offering.
No, it's not the offering the solution.
Yes.
We are just trying to find out. First, the reason we have to understand. We have to understand that this is a challenge. We have to understand there is a stigma. People should understand it. Proactively, they should reach out to their physician. And then they should rightly refer them to gynecologist,
right person.
urologist, find
Yes.
the solution. And intermittent usage, sometimes there
That
is
is
no
required.
solution. Till that you can use it.
It
This is the complete
it
idea
is like,
for them.
It is like sexual health,
Exactly.
which is not discussed so proactively by our patients, whether diabetic or non-diabetic, with their physicians. So all these things are not discussed. Some of the reasons might be societal related, our education related, but definitely public platforms, educational initiatives that are going to change the mindset. I believe
Very
that.
true. So, that's very important from a clinician perspective. Suppose we find the solution and we don't find the solution, or till we get the solution and patient wanted to get till that intermittent use of the solution, how patient will respond to a diaper recommendation from a physician? I mean, just by writing, they may have another complaint that, it is very difficult, because I personally feel unless you have some neurological issue, one will not able to void inside, even if you are given a adult diaper. So that's again a very important, how they will see that diaper recommendation. How can education and early support, initial phase, even if you recommend them, it will be very difficult for them to understand and to do it, and address these myths, or at least their stigma can be reduced by physician by giving them that this is till that you get the final solution. This can be, or for some of the patient, it can be the only solution for them. Improve the acceptance, enhance their dignity and at least quality of life. So this is the question to all physicians who are in panel, and to everyone, that how you feel when a physician is recommending a diaper as a solution. What the perspective, what will be the clinician perspective? Do you think that the people will accept it, or there will be more education will be required from your side for getting acceptance? First, that people are not writing. Yes, sir, you can ask. Then I will be asking the same question to all panelists too.
First of all, in elderly people, incontinence comes rarely. Elderly incontinence. We have to evaluate the cause. One of the important causes is diabetes, retrosaur muscle dysfunction. That is overactive bladder. There are very good drugs are there. If administered those drugs, urinary incontinence will be controlled. Another is in males, benign prostatic hypertrophy is another cause. That also will cause the same problem. If you correct that one, that urinary incontinence will be corrected. Like that, there are causes you have to evaluate in males. But females, I do not know. What are the causes? You gynecologist should annihilate it and treat it. You can effectively treat diaper. Even I am practicing right from 40 years as a physician and tackled many types of diseases, including plenty of diabetic cases. But I never find without cause, except usually I find these causes. Overactive bladder, one. Second is benign prostate hypertrophy. That's all. Thank you.
But sir, we don't have the real world data. Even we know that different causes are there. We send the patient to the right person. Still, there are persons who have this complaint, and there are times when they don't go to the doctor also. Like, the commonly in the female, which I have seen, with the coughing, they because of, and they leak the urine. And for occasional such type of symptom, they, even if you ask them, they don't go to the doctors, and they find sometimes there is no solution also. Recurrently, they develop infection, and they try to just get antibiotic, and they feel that this is all because of infection. So there are challenges. It is not like that. We don't have the real world data, neither it is published, not that but we have whatever the data which is published shows that it's a large number of patients have the issues and the challenges at this point of time. The point is, what will be the physician, his perspective, or a clinician perspective, when he prescribe it, will it be accepted? As you had said very rightly that people will not be accepting it. Definitely as a physician, first time is you have to ask, or the patient is asking, you have to rightly diagnose them, or you have to refer them at a right person. Yes, any opinion from Dr. Jha and Dr. Rajput? Please.
In a neurogenic bladder, that,
Urogenic bladder, which you are talking.
that's third cause. Without any cause, still incontinence. But ladies, I do not know, madam, including females, a gynecologist should evaluate it, then tell me the answer.
No,
Why
it's
there
a
is incontinence
gynec
in
urologist. It's not gynecologist problem. It's a gynec urologist. Yes.
Firstly, I will thank Dr. Rajesh for his input. Yes, it is an elderly phenomenon, but diabetes does create havoc with the autonomic nervous system and the endothelial system, so the incidence is much more. So along with the intense glycemic control, proper training about the continuous glucose monitoring, or maybe the glycemic control, number one. Secondly, some exercises, all types of exercise should be taught to the patient, particularly pelvic floor exercises. Kegels exercises, they can go a long way in stopping all these symptoms. And as you have said, that certain drugs like anti-muscarinic drugs and beta-3 agonist drug, they can help quite a lot in the overactive bladder. So we have a lot to offer. And diaper at all, it is the last phenomenon, as you said, in the neurogenic bladder, where the nervous system is destroyed and neurogenic bladder has been created. Then in those cases, maybe we will require catheterization and diaper and etc. But there is a lot we can do as physician.
Sir, as a public health specialist, I would like to advise that in some cases there are myths that if they once start using diapers, they will be dependent on them because they will lose their control. But in cases those who are elderly, very elderly, having quality of life compromised because of frequent going to washrooms in the night, they are at risk of falls, and the caretakers are also getting problems of this type. Definitely in these cases, diapers can help.
Sir, first of all, I want to thank Bansi Sahu sir for bringing this topic. This topic is very close to me because I think Vasant Kumar sir knows this, because Vasant Kumar sir was treating for my grandmother for past 40 years, and sir has identified early urinary incontinence. Initially, when we advised for urinary yes sir, and initially when we advised we should use these diapers, initially my family was very tentative, that they called me immediately and they told whether we should use this thing or not. Then I told, yes, we need to use because sir was recommending. And the thing is that my grandmother was suffering because when it was in her active locomotor stage, whenever she wants to go to any function or to attend, because family teaching is very important, sir. That is the thing where there was there. And when we got the family teaching, and then we were surprised that my grandmother itself was using it by herself, and that is the thing I wanted to say, because family, yes sir, family teaching is the thing we should advocate for them.
Not only the patient, is caregiver, family, everyone should accept it. And
Yes,
when
sir.
it is particularly for long term or lifelong, then definitely everyone should understand the importance of it also.
Thank
I
you so
understand
much,
fully,
sir.
I take care.
Thank you, sir.
So Dr. Vasant Kumar, you want to add anything? Okay, that's fine. So here, we are here, the idea of this referee aim to contribute the patient quality of life through our diaper solution. In what ways can we provide the most effective support in terms of product? And are these specific area in diaper which can be accordingly improved? So this is very general question. Anyone can give the answer. For any company, it's like a improving first the awareness, increasing awareness, and then improving the quality of life. So both the things has to be done simultaneously. From company, we are looking for that how they can create a market for awareness, and from doctor side or from organization, how we can increase awareness to the patients directly, like putting the standee, or a patient should not feel shy in front of the doctors to talk about it, or then the doctor will give solution. It's not that only this is the solution, but we can investigate. Or at the same time, we will also ask the doctors that they should ask this question, leading question to the patient, rather than just waiting that they will ask. Or the third solution is, because time is a constraint for the doctor, they can have a checklist outside. So in the checklist, which I do that, my assistant doctor or my educator, we are putting so many things in that, and we can put all these things in the checklist, that whether, when last vaccination is done, whether you walk or not, whether there is an increase in weight, there is an hypoglycemia. So we had put a lot of things. Can be also one of the things in the checklist which can be done. So out of those 50 things, if 10 things which is not done as per the doctor advice, then doctor will discuss only those 10 things, because 40 things is already done, which is outside your person is knowing. Because for a doctor in 10-minute, 5-minute consultation, may be difficult for 50 things to be discussed, and he may miss. But if anybody wants to add in this, most welcome. Then we are having that, do these urinary concern have downstream impact on diabetes management? Do you think that a patient with complaint related to this will also have issue with their sugar fluctuation, with their uncontrolled diabetes, with their physical activity and emotional well-being? So we all will agree with that. For emotional well-being, definitely it will be a challenge. But for treatment adherence of a diabetes management, which is again a two different things will be there together. But definitely a persons with a complaint related to complaint, if they develop recurrent infection, will definitely change their complete glycemic pattern. And one very common thing which, as a for the doctors, I'm just, because many times blindly quinolones is written in a persons with diabetes by general practitioner, by urologist, as well as by primary care physician and gynecologist also. Quinolones causes dysglycemia. It can lead to hypo and hyperglycemia, both. So that's a request for all doctors who are there, that they make a call any time in midnight. They have to ask the first thing, which is a one very important challenge. And the last, which is, do you feel there is an unmet need today for a very holistic, patient-centric support solution for people with diabetes dealing with urinary complication? So again, I'm asking Dr. Rajput and Dr. Jha, both, that do you think there is an unmet need today for very more holistic and a very patient-centric support solution for people with diabetes? One from a public health point of view,
Sir,
and then from a clinician
point of view, there is a dire need, because in lot of cases with only one horizon of treatment is sought by the patient, and for other problems either they are not aware or they are not seeking care for that.
Yeah.
Indeed, a holistic approach is the need of hour. Firstly, educating the community about these problems, having discussion amongst them. Like we have the type 1 diabetes society, we can have the incontinence society in the future maybe. And yes, if the patient already develops this and patient is diabetic, intensive diabetic control, we have got the disease modifying drugs like SGLT2 inhibitor, GLP-1 receptor agonist and SGLT2 inhibitor. They have their got their own side effects and don't help also. So judiciously choosing the pharmacotherapy is one thing. Lifestyle modification cannot be overstressed. We have to explain to the patient that it is very difficult to treat a condition if it arises, and in the first place, if we can prevent them through exercise, through lifestyle modification, along with proper pharmacotherapy, these problems you will never possibly develop in your life. And if you at all develop, then the psychological assurance should be given. And urinary catheterization and diapers, this should be the last resort. If it is done, this should also be given. And they should be provided the self-esteem. It is okay if you are failing with normal approaches, and sometimes we do require the supportive need to increase your social contacts, to increase the social networking. You are not avoiding the parties. You can lead a normal life with this supportive care. Thank you.
One of the major things that, to tell it in a very simple way, is that the aim of the clinicians is that improve the quality of the life of our patients. And second thing is reduce the suffering, not only suffering, even the discomfort, the simple discomfort that makes their life better. So whatever is required, we should do.
Yeah, I support the discussion which has been going on, and definitely we should consider our patients. And I think this, as a physician, I would never think of diaper as a solution till now. So I think you have really opened up this whole the thought of thinking, and especially for active women who have to go for meetings or or during the travel, where long travels particularly, if they experience this, I think diapers is a very big solution apart from all other treatment that we plan.
Really, you have very rightly said that as a physician, you never thought a diaper can be a solution for that. And most of the physicians who are attending this meeting, they never thought that a Diabetes India and Bansi Sabu will ask for a diaper company to be the part of that solution. And I have put in one of the in program book also, you will find the last page a full advertisement of Life Free. So I mean, I'm not taking compliment for it. Some of them may complain me also, but I love this topic, to be very frankly, because I learned a lot of things for this. And
May I request you to kindly have a full session in next Diabetes India on this topic?
thank you. So I mean, it is what I have done. What I have done, other than this half an hour panel discussion, which is more related to adult diaper, in diabetes and elderly interest group, this year we had kept on a focus on a urinary issues which are there in the elderly. So which includes diabetic cystopathy, urodynamics when to be done, and a persons with a autonomic neuropathy dysfunction with the bladder. So these are the challenges and which we have discussed with the 5 and 10 minutes discussion which we have. And some of the posters and paper which had come related to this, we have asked them to do a oral presentation. So this much we have done, try to increase some more awareness for that. But urinary care is not a supplement. But I think with elderly person, with a person with diabetes, I think it is assessing them and giving them a right solution will improve the quality of life. And that's very important. And that message I want to give. I'm not saying that all the people with any complaint should be given a solution only by giving that. But in a intermittent care or a early in the course, we should ask for this and we should give the solution. Solution may be diaper till that they have a right solution, or if they may be for a long term. But definitely still they have stigma. As a doctor, by talking to them, relieving their these issues, and will definitely decrease their stigma also. With this, I thank Unijam and for your vision to be partner with an organization like this. You are directly over the counter selling, and you are doing a lot of activities, and you all other products which are number one in their respective this. But I am very thankful to you that you partner with us, and we are discussing because of you a very powerful tool, and your close association with us will definitely work. We will in future too. And thank you once again to everyone, all the